When I saw Tap laying face down in the pool, I screamed help as loud as I could and jumped in. And I grabbed him and flipped him over. And he was not alive. The ambulance got there and they took him.
I was in shock because I didn't know it was as bad as it really was because I wasn't here. They had him intubated, had him on the breathing machine. We were in the PICU 11 days.
Being brought up to the PICU means your child is a little bit sicker than being on any general floor. We have to protect them in the best way possible, and we have to promote an environment that facilitates that.
We take care of any child that has critical illness, severe trauma, or other illnesses that require constant monitoring and specialized care. That's where they come. Our nurses for critically ill patients can be one-on-one, even sometimes two nurses to one patient, but most commonly it's one nurse for two patients. And our rooms are such that the nurse can be sitting between the two rooms and have actual direct visualization of the patients at all times.
Visiting hours are from 8 a.m. to 8:30 p.m. and that is when we encourage other family members to come provide support for the family. We do only allow 3 visitors in the room at a time during the day, and then of course the 2 parents are allowed to stay overnight.
So if your spouse comes with you or someone else comes to stay with you, we have sleep rooms that they're more than welcome to sleep in. You just go to our front desk and ask our secretary, and they'll be more than happy to let you into those areas.
So in the same area as the sleep rooms, we have showers. We have 2 separate showers that are cleaned throughout the day. We also have family packs that provide them with shampoo and conditioner, toothbrush and toothpaste, so that we can try to make this a home away from home.
Bathrooms that are out in our family lobby area. We have 2 bathrooms out there. There's chairs out there that people can sit in and visit.
So no one under 16 is allowed on this floor at all. We don't want a lot of kids wandering around catching things from other kids or seeing things that they don't need to see.
We actually don't allow eating in the room by parents. Of course, the children are able to eat in their room. Parents can have covered drinks.
We're a locked unit, and you have to pick up the phone by the door, and they'll hit the buzzer and let you in because we monitor who's coming in and out of the rooms. If you have any concerns about the care your child is receiving, or you're not happy with something, or you're loving something that's going on here and you think it's great, they would love to hear that, and they'd love to address your concerns and take care of them.
Our daughter, she was pretty traumatized also. Even our family members say when they got there to take Gardner, she didn't want to leave the child life specialist. That's how sweet she was to her.
Being a child life specialist is the best job in the whole wide world. I come in and I get to be the fun person, the play lady, the bubble lady. My job is to come in and assess how your child is coping with the hospital setting. I don't focus on just your child, I focus on you as a parent too. I need to make sure that you're coping so that your child can cope well too, because your coping affects your child.
We really like the parents to be there when we're around so they are well aware of the plan and they can provide their input.
Each doctor that came in there, they were all on the same page, and it was a wonderful experience. Our outcome really couldn't have been any better. He made a miraculous recovery.
We were able to leave the hospital with a 100% healthy child. We have an invaluable resource here in Columbia with the Children's Hospital, with the child life specialists, with the nurses and the doctors that are there. People are getting the very best of care.
This is my pay it forward, and it's my opportunity to give back to the community.
I can really get to make my patients a part of my family.
Our doctors are awesome. Everybody wants to be here.
They're in the best place they can be anywhere in the Midlands, and that is in the pediatric ICU. And so they have a very team approach. We believe every child is our own, and we're going to treat them as if they're our own baby, and we're going to do the best we can to make them better.